Hey, Alpha Nurses, I'm Licensure from alphanurseguide.com. This is 18 Practice NCLEX questions. Without delay, let's get started.
An 18-month-old with congenital heart defect is to receive digoxin twice a day. The nurse should instruct the parents about which of the following? 1. Digoxin enables the heart to pump more effectively with a slower and more regular rhythm. 2. Signs of toxicity include loss of appetite, vomiting, increased pulse, and visual disturbances. 3. Digoxin is absorbed better if taken with meals. 4. If the child vomits within 15 minutes of administration, the dosage should be repeated. The correct answer is 1. Digoxin's effect is to slow the rate of the electrical conduction to the heart and increase the strength of the heart's contraction. Signs of toxicity include anorexia and decreased heart rate. Digoxin should be taken 1 hour before meals or 2 hours after meals in order to obtain better absorption of the drug. If the child vomits within 15 minutes of administration, the dose should not be repeated because it is not known how much of the medication has been absorbed. The nurse should caution sexually active female clients taking isoniazid, INH, that the drug has which of the following effects? 1. Increases the risk of vaginal infection. 2. Has mutagenic effects on ova. 3. Decreases the effectiveness of hormonal contraceptives. 4. Inhibits ovulation. The correct answer is 3. INH interferes with the effectiveness of hormonal contraceptives, and female clients of childbearing age should be counseled to use an alternative form of birth control while taking the drug. INH does not increase the risk of vaginal infection, nor does it affect the ova or ovulation. The nurse should teach clients that the most common route of transmitting tubercle bacilli from person to person is through contaminated 1. Dust particles. 2. Droplet nuclei. 3. Water. 4. Eating utensils. The correct answer is 2. Tubercle bacilli are spread by airborne droplet nuclei. Droplet nuclei are the residue of evaporated droplets containing the bacilli, which remain suspended and are circulated in the air. Dust particles and water do not spread tubercle bacilli. Tuberculosis is not spread by eating utensils, dishes, or other fomites. In a family education group for those who have relatives with paranoid schizophrenia, which of the following comments indicates the need for further teaching about symptom management? 1. When the clients get overwhelmed, it's best that they spend some time in their room. 2. The more we push the clients to spend time with friends, the more their voices decrease. 3. Until we get the clients up and going, they seem to have no motivation to do anything. 4. We still have to remind the clients that we don't hear the voices they do. The correct answer is 2. Pushing a suspicious client into social situations is likely to increase anxiety, which increases, not decreases, the hallucinations. The statement about spending some time alone if the client is overwhelmed indicates awareness and understanding of how to intervene when the client is exposed to stress. The statement about lack of motivation indicates awareness and understanding of avolition. The statement about reminding the client that the family doesn't hear the voices indicate awareness and understanding of the client's hallucinations. A client states that she hears God's voice telling her that she has sinned and needs to punish herself. Which response by the nurse is most important? 1. How do you think you'll be punished? 2. Please tell staff when you think you need to punish yourself. 3. What exactly do you think you have done to be punished? 4. Let's talk about your strengths. The correct answer is 2. The client is at risk for harming herself because of the command auditory hallucinations. It is most important for the staff to know if she currently thinks she needs to punish herself. Then it is important to know how she thinks she might punish herself. Knowing what she thinks she has done is relevant for changing her negative thinking. Focusing on her strengths will help improve her self-esteem. A client is becoming agitated during a discussion group. She states, "I know that all of you hate me." She leaves the group and goes to her room. Which action by the nurse is most therapeutic for the client? 1. After group, ask the client to talk to the nurse about her concerns. 2. Ask the client to return to group and share her feelings. 3. Explain to group members about the client's problems. 4. Ask the group members to apologize to the client individually. The correct answer is 1. It is appropriate to talk alone with this client about her feelings. A suspicious client is unlikely to agree to talk about feelings in a group. It is a violation of the client's privacy to reveal a client's problems to group members. The other clients in the group have no reason to apologize, and the nurse should not ask them to do so. A client presents to the OB triage unit with a report of bright red vaginal bleeding that has saturated a peri-pad over the last hour. The nurse observed the fetal heart rate with a baseline of 130 decreasing to 100 for 60 seconds and then returning to 130. There are no contractions present. Which are the priority nursing interventions? 1. Ask client time of last oral intake and prepare to start an IV. 2. Continue to observe, monitor, and perform Leopold's maneuver. 3. Apply oxygen by face mask and perform sterile vaginal exam. 4. Place client in hands and knees position and call primary healthcare provider. The correct answer is 1. Because the woman is currently bleeding and the fetal heart rate is showing decelerations, the woman would need fluid replacement and a possible emergent cesarean birth. The woman may also need fluid volume replacement. The nurse can prepare for this by asking last oral intake, obtaining IV access. The client should be placed in a lateral position to enhance uteroplacental blood flow and given oxygen. The nurse should notify the primary healthcare provider as soon as possible, but the hands and knees position is indicated only if the client is experiencing back labor or umbilical cord prolapse. Leopold maneuver is done to determine fetal position in utero and would have already been done prior to placing the fetal heart rate monitor. After administering hydralazine 5 milligrams intravenously as prescribed for a premigravida client with severe preeclampsia at 39 weeks gestation, the nurse should assess the client for 1. Tachycardia, 2. Bradypnea, 3. Polyuria, 4. Dysphagia. The correct answer is 1. One of the most common adverse effects of the drug hydralazine is tachycardia. Therefore, the nurse should assess the client's heart rate and pulse. Hydralazine acts to lower blood pressure by peripheral dilation without interfering with placental circulation. Bradypnea and polyuria are usually not associated with hydralazine use. Dysphagia is not a typical adverse effect of hydralazine. A 17-year-old client at 33 weeks gestation diagnosed with mild preeclampsia is treated as an outpatient. The nurse instructs the client to contact a healthcare provider immediately if she experiences which of the following? 1. Blurred vision. 2. Ankle edema. 3. Increased energy levels. 4. Mild backache. The correct answer is 1. Severe headache, visual disturbances, such as blurred vision, and epigastric pain are associated with the development of severe preeclampsia and possibly eclampsia. These danger signs and symptoms must be reported immediately. Severe headache and visual disturbances are related to severe vasoconstriction and a severe increase in blood pressure. Epigastric pain is related to hepatic dysfunction. Ankle edema is common during the 3rd trimester. However, facial edema is associated with increased fluid retention and the progression from mild to severe preeclampsia. Increased energy levels are not associated with the progression of the client's preeclampsia or the development of complications. In fact, some women report an energy spurt before the onset of labor. Mild backache is a common discomfort pregnancy, unrelated to progression of the client's preeclampsia. It also may be associated with bed rest when the mattress is not firm. Some multiparous women have reported a mild backache as a sign of impending labor. After surgery to correct the tetralogy of Fallot, the child's parents express concern to the nurse that their 4-year-old child wants to be held more frequently than usual. The nurse recommends 1. Introducing a new skill. 2. Play therapy. 3. Encouraging behavior. 4. Having the volunteer hold the child. The correct answer is 2. The child is exhibiting regression. During periods of stress, children frequently revert to behaviors that were comforting in earlier developmental stages. Play therapy is one way to help the child cope with the stress. Teaching a new skill most likely would add more stress. Parents should be instructed to praise positive behaviors and ignore regressive behaviors rather than calling attention to them through encouragement or discouragement. Having someone else hold the child does not encourage coping with the stress or promoting appropriate development. Discharge teaching for a 3-month-old infant with a cardiac defect who is to receive digoxin should include which of the following? Select all that apply. 1. Give the medication at regular intervals. 2. Mix the medication with a small volume of breast milk or formula. 3. Repeat the dose one time if the child vomits immediately after administration. 4. Notify the primary care provider of poor feeding or vomiting. 5. Make up any missed doses as soon as realized. 6. Notify the primary care provider if more than 2 consecutive doses are missed. The correct answers are 1, 4, and 6. To achieve optimal therapeutic levels, digoxin should be given at regular intervals without variation, usually every 12 hours. Vomiting and poor feeding are signs of toxicity. If more than 2 consecutive doses are missed, interventions may be needed to assure therapeutic drug levels. The medication should not be mixed with any other fluid, as refusal may result in inaccurate intake of the medication. Taking make-up doses or taking the medication at times other than scheduled may adversely affect serum levels. A client with tuberculosis is taking isoniazid, INH, to help prevent development of peripheral neuropathies. The nurse should instruct the client to 1. Adhere to a low cholesterol diet. 2. Supplement the diet with pyridoxine. 3. Get extra rest. 4. Avoid excessive sun exposure. The correct answer is 2. INH competes for the available vitamin B6 in the body and leaves the client at risk for development of neuropathies related to vitamin deficiency. Supplemental vitamin B6 is routinely prescribed. Following a low cholesterol diet, getting extra rest, and avoiding excessive sun exposure will not prevent the development of peripheral neuropathies. The nurse is reconciling prescriptions for a client diagnosed recently with pulmonary tuberculosis who is being admitted to the hospital for a total hip replacement. The medication prescription sheet says isoniazid 300 mg PO daily, rifampin 600 mg PO daily, pyridoxine 10 mg PO daily, ethambutol 400 mg PO daily, and pyrazinamide 1.5 grams PO daily. The client asks if it is necessary to take all of these medications while in the hospital. The nurse should 1. Request that the healthcare provider review the prescriptions for a duplication between isoniazid and ethambutol. 2. Inform the client that all drugs will be discontinued until the client can eat solid foods. 3. Ask the pharmacist to check for drug interactions between the rifampin and isoniazid. 4. Tell the client that it is important to continue to take the medications because the combination of drugs prevents bacterial resistance. The correct answer is 4. The nurse should tell the client that it is necessary to take all of these medications because combination drug therapy prevents bacterial resistance. They will be administered throughout the hospitalization to maintain blood levels. The healthcare provider will review the prescriptions per hospital policy because the client is being admitted to hospital. There is no duplication between any of the drugs being prescribed for this client. It is not necessary to ask the pharmacist to check for drug interactions, as these drugs are commonly used together. A newly admitted client diagnosed with paranoid schizophrenia is pacing rapidly and wringing his hands. He states that another client is out to get him. Then he says, "Protect me, select me, reject me." The nurse should next 1. Administers oral PRN lorazepam and haloperidol. 2. Place the client in temporary seclusion before he has a chance to hurt others. 3. Call the primary healthcare provider for a prescription for restraints. 4. Ask the other clients to leave the immediate area. The correct answer is 1. The client anxiety as reflected in rapid pacing and clang associations is rising as a result of his paranoid delusions. Administering the lorazepam and haloperidol will help the anxiety and delusions. The client is not threatening others at this point, so seclusion, restraints, and asking clients to leave the area is not necessary. The wife of a client diagnosed with paranoid schizophrenia visits 2 days after her husband's admission and states to the nurse, "Why isn't he eating? He's still talking about his food being poisoned." Which of the following appraisals by the nurse is most accurate? 1. The wife's inquiry is reasonable. 2. Education about her husband's medications is needed. 3. Her expectations of her husband are realistic. 4. An increase in the client's medication is indicated. The correct answer is 2. For the client with paranoid schizophrenia, 2 days on medication is too short a time for improvement to be seen. Therefore, the nurse evaluates the client's wife as needing education or knowledge about paranoid schizophrenia, the course of the illness, and medications. Expecting an absence of delusions by the end of the client's second day of hospitalization is unrealistic. Rather, the nurse would reasonably expect delusions to decrease, disappearing by 5 to 9 days of hospitalization. The wife's inquiry is not reasonable because not enough time has elapsed to evaluate the effectiveness of treatment. An increase in the client's medication would be unreasonable because not enough time has elapsed to evaluate the effectiveness of the medication. Generally, a time frame of 5 to 7 days is needed before the effectiveness of medications can be determined. A young client diagnosed with paranoid schizophrenia is talking with a nurse. "You know, when I thought everyone was out to get me, I was staying in my apartment all the time. Now, I'd like to get out and do things again." What is the best initial response by the nurse? 1. With whom do you want to do things? 2. What activities did you enjoy in the past? 3. What kind of transportation do you use? 4. How much money can you spend? The correct answer is 2. Knowing the client's interests is the best place to begin to help the client re-socialize. Knowing with whom the client wishes to socialize, what transportation she has, or how much spending money she has may be relevant questions, but should be asked after the question concerning what activities the client enjoyed in the past. A client presents to the OB triage unit with no prenatal care and painless bright red vaginal bleeding. Which interventions are most indicated? 1. Applying external fetal monitor and complete physical assessment. 2. Applying external fetal monitor and perform sterile vaginal exam. 3. Obtaining a fundal height physical assessment on the patient. 4. Obtaining fundal height and a sterile vaginal exam. The correct answer is 1. Bright red vaginal bleeding without contractions could indicate a placenta previa. A sterile vaginal exam should never be done on a woman with a known or suspected placenta previa. Applying the external fetal monitor will allow the nurse to assess fetal status. A complete physical assessment of the patient is indicated. A fundal height is used to monitor fetal growth during pregnancy, but does not provide information related to vaginal bleeding. As the nurse enters a room of a newly admitted premigravida client diagnosed with severe preeclampsia, the client begins to experience a seizure. Which of the following should the nurse do first? 1. Insert an airway to improve oxygenation. 2. Note the time when the seizure begins and ends. 3. Call for immediate assistance. 4. Turn the client to her left side. The correct answer is 3. If a client begins to have a seizure, the first action by the nurse is to remain with the client and call for immediate assistance. The nurse needs to have some assistance in managing this client. After the seizure, the client needs intensive monitoring. An airway can be inserted, if appropriate, after the seizure ends. Noting the time the seizure begins and ends and turning the client to her left side should be done after assistance is obtained.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.